Hi, everyone. Welcome to our webinar. I'm Ellie Fody. I'm a senior program officer with the New York Health Foundation, and I'm really pleased to invite you into our conversation. First of all, I hope everyone's staying safe and warm, and I appreciate your patience with us today. We're coming to you live from a blizzard, so I'm coming to you live from an apartment. We've got some internet coming in and out, but we are here today because we've got a packed house and folks really excited to learn about apprenticeships, and we're very excited to talk about apprenticeships all across New York State. I'm going to set the stage for the conversation in just a moment, but first, just some administrative items. Uh, you should see some functionality for closed captioning. We'll also be recording today's session, so you will send a recap out after today with the recording to that session. I see you folks are already on top of it. We encourage you to say hello, say who you are. We want to know who's in the Zoom room together. We want you to say hello to everyone else. And I would really encourage you to please share your questions. Oh, I'm hearing there's an echo here. Echo. Um, Okay, I'm going to keep going on my end because not a universal echo. Thank you, chat. Thanks for dealing with us. Great. Okay, well, look, you already have understood the assignment. We are a participatory bunch, and that is great. Speaking of which, even beyond saying hello and helping us with our tech issues, we would love for you all to put comments and questions in the chat, and I will lift that up into our conversation and pose them to our illustrious speakers. All right, with that, in terms of setting the stage, what brings us all here today is apprenticeships, and particularly apprenticeships for community health workers, CHWs, and medical assistants, MAs. And there's a lot of energy around apprenticeships, as there should be, this opportunity for folks to earn while they learn and growing in their profession. There's a lot of value for that in terms of community health workers and medical assistants in getting on the job training, in growing in their field, in being able to integrate into a team more immediately and work with community members and clients and patients. And on the flip side of the coin, with employers, they get to sooner rather than later reap the benefits of working with and engaging community health workers and medical assistants because they are uniquely equipped to form trusting relationships with community members, with clients, and with patients. And yet, apprenticeships aren't one size fits all. It's not a plug and play model. Apprenticeships were created in other industries like manufacturing, and we all know that community health, healthcare are different animals. And then when we layer on top of that the idea of leveraging apprenticeships to train professionals from the communities that they're serving, like CHWs and MAs, there are other sets of needs with respect to making sure apprenticeships work for CHWs and MAs and for the organizations that are training them and employing them. So that's really the heart of our conversation today. We're going to hear from apprenticeships programs that have pioneered models across the state to train community health workers and medical assistants, upstate, downstate, across the state. We'll hear from them on how they've cracked the code with their apprenticeship programs, the successes they've achieved, the challenges that they've faced, and collectively we'll talk about our vision for scaling apprenticeships across New York State and making them work better for CHWs and MAs, ultimately the beneficiaries of these training, and the organizations that employ them and the people that they serve. That's only made possible by this illustrious panel. So joined with me today, we have Jacqueline Sweeney, who's the Executive Director of the Community Health Workers Association of Rochester, Liliana Heredia, Chief Operating Officer of the Community Healthcare Association of New York State, Lucia Colindres-Vasquez, Chief Operating Officer of Ibero-American Action League, and Renee Whiskey-LaLanne, Associate Director of the Community Health Worker Institute at Montefiore Einstein. Just with those names and titles alone, I am not doing these incredible people justice. I would encourage you to look them up, to hear about their paths to leadership and the great works that their organization is doing, and to get in contact with them to learn more. Also today, in an hour, our time is going to fly, and so we won't have an opportunity to dig deep into registered apprenticeship programs. There's a lot of structure involved, there are requirements, and so similarly, I would encourage you to get in touch with these programs, with other workforce development organizations, and even the Department of Labor to better understand the ins and outs. What we are going to do today is to get to the heart of what it's like on the ground to stand up, run, adjust, and make work apprenticeship programs for community health workers and for medical assistants across the state. So our run of show is going to be, we're going to have each apprenticeship program speak about that work for about 10 minutes, just to tell us the story about how this came to be, how it's working, and where we go from here. And then I'm going to moderate a conversation for the second half of our session. So to get us started, I'm going to hand it over to Lucia and Jacqueline to share with us the CHW apprenticeships in Rochester.
Sure, thank you, Ali. I'll get started, and Jackie, you can go after and talk about the training and our collaboration. So my name is Lucia Colindres. I hope everyone's doing well. I'm a community health worker, and I have been a community health worker for over 25 years and fell in love with the profession. And I now work for Ibero-American Action League, which is a not-for-profit organization that's been around for almost 60 years. We serve Latinos, and we are across the state in different places. We started with a workforce development program and decided to apply for the apprenticeship program because there was a HRSA grant, which we didn't get. But we were still excited. We actually had a really good chance of getting it, but they ran out of money and they ran out of funding. And because we did so great with the application, we thought, hey, we kind of have a framework in place. Why not put it to work? We applied for the apprenticeship, and we've been around for almost 3 years now since we registered the apprenticeship. But the apprenticeship is not like an association because there's different levels of apprenticeship. So it works for our own staff. So we can hire individuals that can be in the apprenticeship, and we can train them, and then they could also transfer to other organizations. We have a great collaboration because I am also part of the Community Health Workers Association of Rochester, which is Jackie is our executive director. And so we provide the apprenticeship opportunity and the 2,000 required hours for the apprenticeship. And Schwar, we have a collaboration with Schwar to do the training. Now, the training is very hands-on. Jackie can talk a little bit more about that. But in addition to that, the requirement of the apprenticeship is that there are some college credits that they need to have. And we've been very successful with collaborating with our local Monroe Community College. And because they're in the apprenticeship, they can get scholarships. So, it just it works out really well. Ibero also has a long history as a non-for-profit organizations to provide a lot of services to the community. So that means we serve youth, elders, OPWDD, and a lot of other programs. So for our community health workers, they're very diverse in which they're kind of special skills or programs that they work with. I think the challenge for us has been more of like the journey workers because you can only have 1-to-1. That means that only one community health worker can be supervised by a journey worker, which is kind of like the supervisor. But we've been really successful. The other exciting thing I wanted to mention regarding our apprenticeship is the partnership that we have with our local WHEEL, which is the Workforce Investment Organization, for the Career Pathways Training, or CPT. There's a lot of conversations around the waiver, 1115 waiver, and we have a great relationship with them. So we've been able to incorporate CPT and apprenticeships. It's like a great opportunity. So Jackie, do you want to talk a little about how we were able to merge the training and the components and the guidance by the Department of Labor and those requirements?
Hello, everyone. My name's Jacqueline Sweeney, and I hope everyone's doing well today. So the Community Health Workers Association of Rochester Schwar, we were very fortunate because our existing CHW curriculum that we developed probably about 20 years ago aligns nicely with the apprenticeship program. So we invite community members who are interested in becoming community health workers. We invite them to join our training, which consists of 85 hours of classroom training, in-person classroom training, and 80 hours of internships. And once they have completed that training, and they have some experience because of the internship, they are fully equipped to then move on to become apprentices if they so choose. And the apprenticeship program, we meet monthly with our apprentices, and we also meet monthly with our journey workers. And this way, our journey workers we can support our journey workers while they support our apprentices. And so we're not training our journey workers, we're just keeping them up to date and abreast on what the apprentices are learning, so that when the journey workers meet with their apprentices, then they can follow along and guide the apprentices on their journey through the training. And and it's been going really well, and we have a good number of apprentices in the program.
Thank you both so much. Before I pass the baton on to Renee to continue describing Montefiore's apprenticeship program, I wanted to sneak in a question from the chat because it related, Lucia, to what you had mentioned around college credits. We got a question in the chat around the college credit requirements. This individual in particular was asking around a situation where someone has a BS in criminal justice, but in general, would you just take a step back and help us understand the college credit requirements?
Yes, thank you for that question. I saw it popped in, and so the requirement is really just two courses, two classes that align with Appendix B, I'm sorry, which has to do with health or can be human services. And many individuals already have some college credits that they can transfer already. I have had some apprentices that the Department of Labor would take, we send the transcripts and then they say, yes, this will be something that we can take. Or they might say, no, that does not qualify. But it does not need a bachelor's level. It's basically a couple of credits that need to be counted as part of the apprenticeship, which is great. And that's our experience. That has been our experience.
Thanks so much, Lucia. One more question in this front. I know we're going out of order, but I want to honor the chat. Good questions coming in. This is more of a theoretical question around what it means to have college credit requirements for an apprenticeship program for folks that may, for one reason or another, decide not to pursue college, particularly when we're talking about community-based professionals like CHWs or MAs. So could you don't need to opine on that question in particular, but talk about how your programs have each navigated that consideration. So Lucia and Jacqueline, if you want to start, but then I'd also welcome, if you have any thoughts, Renee and Liliana, for you to chime in as well.
I can answer that because I'm very sensitive about that. That was one of the requirements that I had a really hard time with because we're so diverse, and then people get nervous sometimes, right? Like when we start talking about that. We here in our area, there is a training related to community health workers, and some of those classes are very different from our grassroots training. So sometimes our students need additional support with that. And what we do is we provide those additional support so that they can be successful. We also talk about what classes might be, something that's beneficial to them. But it is hard sometimes, is a barrier sometimes for recruitment for us, because there are individuals that are just not interested in that.
Okay, thanks. I'm going to, in a second, pass it on to Renee. Any other thoughts for the good of the order as it pertains to college credit requirements before, Renee, you take it away? Okay, Renee, please.
Right. Good afternoon, everyone. The Community Health Worker Institute has had community health workers, oh, I should say Montefiore has had community health workers since the 70s. So community health workers are not a new institution to Montefiore, but in 2021, we embarked on a journey to have this institute, which helps us standardize how we recruit, train, and integrate community health workers across our system because we felt there was a need to have community health workers working. In many more spaces than they were working in before. And so, with that in mind, in 2022, when we hired our first community health worker, we thought to ourselves, we are planning and operationalizing a lot of training and a lot of opportunities to professionalize community health workers on clinical teams. What more could we do? Um, we right now have a team of 30 community health workers, and their focus area is really on working with patients to address their health-related social needs. And so when they come on board with us, we offer them about 4 weeks of onboarding training that really focuses in on what it means to be a community health worker here in our system, what it's like to integrate onto a clinical team, and then how to do the concrete things on the job, right? What happens when a patient says, I don't have enough money to pay for food, or I have this housing issue? What are the concrete things you do as a CHW here? And our CHW team is really, they are supported by a union. They're a part of the 1199 union, where in our previous experience with community health workers, many of our community health workers use their 1199 benefit to go back to school and get degrees and do the things while they're working. And we thought, well, how can we pair those two opportunities and really help them do this as they work? And one of the most frequent questions we get from our clinical teams is what kind of training does your CHW team have? And the minimum requirements for our job here is a high school diploma and about a year or two of community experience. And we consider community experience to be many things. It's a wide breadth and scope of what community experience means to us. And so we thought this was, apprenticeships are a unique opportunity to kind of marry that college level coursework, on the job learning, the supportive supervision that we wanted to provide, but also give people the opportunity to earn and learn at the same time, and give them a good public health foundation. And the truth is, our team, as to Lucia's point, our team is a mixed bag. We have community health workers who come in who have had some college experience, who have had no college experience, who have attained a degree. And so we needed to figure out but they might be new to the healthcare system. So how do we tie all these things together? And so we embarked on this apprenticeship process. We've since had 3 apprenticeship cohorts starting in 2022. The first 2 cohorts, we registered just over 40 participants and had about 80% completion. So we had about 22 community health workers who got the New York State apprenticeship certificate out of those who were registered. We're working on cohort 3 right now. They're underway. They've completed their college level coursework. Well, 11 of the 14 have completed their college level coursework and are working in various stages on completing their 2,000 hours of on the job work. And I think we've learned a lot over those three cohorts about the complexities of having a very robust training program, integrating the supportive supervision, dealing with or navigating all of the administrative tasks that are required for the apprenticeship, really supporting our team and contending with the sustainability factor, right? And how do we continue to seek support for our teams and really focus our energy on efficiency and productivity and all the things that will help us maintain this work. And so I'll talk about that a little later on as we think through our panel questions. But I think we've seen a lot of success, and we're really committed to getting this done because we think it is a really viable way to professionalize entry-level staff and community members into healthcare systems. But it is challenging, and there are some operational, I think, improvements that we could make to make it more fitting for our industry and the type of work that we do when working with community members. Thank you for having me.
Thanks so much, Renee. I'm going to pop in for just 1 minute to pose a question. Admittedly, I don't know what this means, but does anyone have any insight on URAC or URAC certification for trainers? If not, we'll figure out a way to get you an answer to your question, Claire, but thank you for your question. With that, last but certainly not least, I'm going to hand it over to Liliana to describe the medical assistant apprenticeship.
Thank you, Ali, and good afternoon, everyone. I hope everyone is safe and warm today with the weather. Again, I work for the Community Healthcare Association of New York State. We are New York State Primary Care Association, a membership organization that represents 70 community health centers operating more than 900 sites statewide. Community health centers serve 2.4 million New Yorkers across the state. The story for the medical apprenticeship program for Jacqueline was across the New York State, we were reporting inconsistency of vacancies and turnover around medical assistants, and that really created instability in the care teams and the patient flow, really challenging recruitment and retention as well. And we recognized there was a need to create a sustainable long-term workforce pipeline instead of just focusing on retention pieces or recruitment pieces. Part of this model really aligns with the Jacqueline's strategic plan back then, that was 2023, and it still does, but also on the community health center model. 76% of health centers provide some kind of training across the state, whether it's hands-on training, formal training, or informal training. So when we learn about the earn what you learn model, really for us was a model that worked for us, but also had two things that were important to us: the access to higher education opportunity and economic empowerment for members of the community, but also for current workforce or employees of the health center. So when we started conversation with the Department of Labor, the trade didn't exist for medical assistant. So it was a little bit different. We have to create the trade, and our partners were the community health centers. We created an advisory group made up of nurses and also an MD, a physician, who really supported the guidance of what were the things that needed to be part of the trade, what were the competencies, how they work, because every health center works in a different way. But we wanted to make sure there was the standardization across the board, and having reviewing from job descriptions to competency to trainings across the board really provided us an excellent guide of how to create the trade itself. So that started the design and planning for the program started in 2023. And the design of the outline, and in partnership with the Department of Labor, we launched our first cohort in 2024. And it was great to see that for us, some current staff of health centers were applying to become MAs. The requirement for this program is having a high school diploma or GED. And for us, made it easier for community members also who wanted to really start working in primary care but didn't have the opportunity to do so. Also, something that we have noticed, and this is really a pipeline program. Some of our apprentice, this is kind of the step on really being part of the care team, but a lot of them are thinking about LPN or even on RN or MP, a nurse practitioner later on the line. So I think the ladder that we're gonna see and the progression for people is something that for us, that's just the goal, is the beginning off for some people, or just starting and changing careers for others. I think the model really strengthens the entire team and improves the coordination and support for quality efforts as well. So that's our story. We work with all the community health centers. The requirement is 2,000 hours on the job training and 144 hours of related instruction. We are the related instruction organization. We develop our own curriculum for primary care. And the reason for that, we wanted to allow some flexibility. As we know, a lot of people, because it's earn while you learn model, being able to learn when you are at the job site and not having to have, other family obligations or barriers for learning. That was really important to us. We do a lot of evaluation. We also do a lot of coaching for the journey workers. For us in our program, the journey workers have to have 2 years at least of experience being a medical assistant. And for us, for some people, this is the first time that they will be supervisors. So being able to support them, to coach them through that, how to provide feedback, how to teach somebody, your day-to-day work. I think that's very key. So I think we see it as almost a two-layer of development for the apprentices, but also for the journey workers or coaches that are really supporting the program. And we also have what we call champions. And I think everybody needs to have that. And it's the people who are really sponsoring the program at the site level, who are really coordinator of the administrative tasks that need to be done and are part of the requirement as part of being an apprenticeship program, but also provide feedback on the program of what's working, what's not working, because at the end of the day, we also want to get the feedback from all the participants in the program. Our goal is to continue this year. This is will be our second year, and to continue to recruit apprentices and sites to work with us. And for us is we just had a graduating class. We had MAs graduate from the program, and the feedback was amazing. People who again were some from the community, some were worked at different health centers. So being able to graduate the class and to hear the impact that the program has had was something that was fairly valuable for us.
Thank you so much, Liliana. And I hope you're already seeing in the chat that there's a similar affirmation of the value of apprenticeship programs around what vocational training can mean like this. I want to lift up one thing that you said around 75% of community health services training on the job, that being a part of the blueprint of CHCs. We know that's certainly the case in CBOs, that being part of the DNA of CBOs, of training staff to be able to further the mission, and at Montefiore and other hospitals. So it's worth calling up that your apprenticeship programs really stem from that same spirit that you and your members all do every day. I am going to ask one question and then we'll start our panel of sorts. One clarifying question from the chat was around what a journey worker is. So Liliana, could you please clarify what a journey worker is? And then someone, Jacqueline, Lucia, or Renee, describe the difference in particular between a journey worker and in the community health worker setting, a difference between a journey worker and a CHW in training.
So that's part of a requirement to be an apprenticeship program, is the model where you have somebody who has already had experience. So in this case, it's an MA who already works at the site what the apprenticeship will be. And the person is really coaching or teaching the on-the-job skills and competencies to the apprentice. So the apprentice is brand new. Let's say somebody who's from the community has a GED, apply for the program. And this person is really guiding them through how to do an intake, how to do all the things that they need to do, as well as they're doing really a feedback on the progression of that. That is a requirement for our program, or for many programs, to have one-on-one. So for each apprenticeship apprentice, we have to have one journey worker. And again, that's sometimes is a barrier because it's hard to get one-to-one, but also I think allows for a lot of support for the apprentice. So so that's what the journey worker is part of the requirement for our program. Again, 2,000 hours, 144 for education, and to have one-on-one journey worker as being able to support the program and the apprentice.
I would say for the community health worker program, we've been able to leverage our supervisors. Most of our supervision team, actually all of our supervision team, has played the part of a community health worker before, either using the exact community health worker title or very similar job title with same work function. But also, we have two training specialists who were formerly community health workers in our department and now have graduated on to training specialists and are providing support to our team. And so for us, it looks like, who are the people who are training our staff on the job to do the day-to-day things? Who can they go to when they have questions? Who's guiding the work and giving feedback on a regular basis? And so it mostly is our team of supervisors and training specialists, and they function as our journey workers on this project.
I was just going to add that in essence is the person assigned by the Department of Labor to supervise that apprentice, because you have to remember that this was created similar to the trades, right? So in trades, I don't know if you're familiar with, when you're an electrician, you have someone that you're assigned to, which is your journey worker, who's overseeing, not necessarily your supervisor or immediate supervisor, but they're in charge of overseeing that you don't get electrocuted, basically, right? Like they're guiding you. They also support your learning as you're learning the skill set. So it has to be someone who has that experience. For us, we're very, very mindful of who that person needs to be, because it's not just about supervising someone. You have to understand the scope of practice of community health workers.
And I would just like to add, the journey workers also can gain a lot from the apprentices. We have seen some policies updated and some changes and adaptation made because the journey workers and the apprentices actually met and discussed some of the covered topics.
Thank you so much, Jacqueline. And it really harkens back to what Liliana said around also thinking about the apprenticeship being supportive of journey workers who have to not just supervise, but be that supportive presence in that educational period. And Jacqueline, like you said, it can be fruitful in terms of what comes out of the journey worker, in this case, CHW relationship. And Lucia, I love what you said around talking about analogous examples in other trades. We are going to get to there, around thinking about this, the parallels and the differences between public health and healthcare and other industries in apprenticeship programs. So now, I'm going to turn us to the Q&A portion, though we've already been doing a lot of Q&A. Let me invite everyone in the chat, please keep it coming with your questions. We will build those in as best we can, including some themes of common questions. And let me shout out the chat. You all are in need of some compliments. First of all, I see some representation from most regions of the state here. I saw New York City, Long Island, Capital Region, North Country, Finger Lakes, Western New York, I'm sure, Mohawk Valley. So if I missed any other regions, call yourself out, but this is really a wonderful statewide swath of folks and folks in the CBO, FQHC realm, training providers and otherwise. So really, really wonderful to have you all be with us and learn from your own expertise. One last shout out on the chat. I saw folks helping out one another, answering each other's questions, speaking up when they're looking for new job opportunities. This really is exactly what we want. So thank you so much. And now it's your turn to keep coming to us with some questions. It will be available at a later time. We'll send out a recording with the webinar in a recap. So stay tuned for that. You can tune in later. All right, let's get into some questions. The first one is around a story around your apprenticeship programs and its successes. You all did such helpful overviews of what your apprenticeships do, what the requirements are, how they function, how they came to be. And yet at the end of the day, we're talking about training individuals and then them going out in the world and being able to serve others. And so I wanted to hear just one example from you all around a success story from your apprenticeship program, or something that took you by surprise in a positive way now that you've undertaken this apprenticeship. So Renee, I'll have you get us kicked off, and then I will pass it along to Lucia, Jacqueline, and Liliana.
Thank you, Ali. I think I'm going to start this question the opposite way, with sharing a challenge that we had with our first cohort and how it has progressed over time. And so we have had the pleasure. We are not the sponsor for our apprenticeship. We are the employer partner, and we have had some wonderful partners along the way. So we've partnered with two local community colleges, as well as the Training and Employment Fund, who I believe is on the call from 1199. So shout out to all you guys, our partners at LaGuardia and Hostos as well. But I think the initial challenge we had with our very first cohort was really thinking about how our community health workers were going to meld three aspects of this program together. So how they were going to really think about how to tie in the didactic piece of the learning, so their college level coursework, with the operational training that we provide when they first get on board, and then their day-to-day function. Imagine it as though, you are working day to day, your patient is coming to you with very concrete questions and needs around I'm having trouble accessing food. I can't pay my utilities. I need to get this mold out of my apartment, or I need an apartment. And you're going to and your operational training that you receive from us covers how you do those things, right? But then you go off to your didactic apprenticeship work and you're talking about very big public health concepts, right? Which lay the foundation for this work. So, what does it mean to be a public health professional? What are CHW ethics and boundaries? What's health promotion and disease prevention? And they really struggled with tying those three things together. So that was cohort one. We worked very hard with our training partners and our sponsors to figure out how do we help craft that message a little better, and how do we make the ties along with our journey workers. And so cohort two got a little bit better, and cohort three, I think the success story I would say out of this is one of the things we learned is we needed to have these conversations early, frequently, and all the time. Well, early, ongoing, and continuously after that. And so in our third cohort, I remember in our introductory session where we talked about how these things tie together, after one of the CHWs was just so appreciative of the opportunity, she started to cry. And she said, for all kinds of reasons, have not ever gone to college. And so this will be my first opportunity to experience what a college level coursework is like. And I don't have to worry about trying to do this outside of my work hours, because it's very difficult for me to do that and contend with the responsibilities I have to my family and all the other things that I have to do. And so that was a real testament to, like, we are really doing the right thing here by our staff, right? We're offering them opportunities to better themselves beyond the scope of being a community health worker. We have known all the time that our community health workers go on to do bigger and better things. And this was just another confirmation for us that we have to keep working at this. We have to keep trying to make it work. The other thing I would think that I would want to share that came out of this is watching our cohorts develop their own little learning communities that has translated into the work that they do day to day. Our community health workers are spread out throughout the Bronx County. And so there are very little opportunities, although we try to create them monthly, both virtually and in person, to come together. There's very little opportunities for them to be in the same room, sharing how their lived experience impacts their work outside of our trainings. But in our apprenticeship training, what I thought was valuable is they were in those classes learning together and sharing things that you wouldn't think are a part of the work, but absolutely impact how they engage with patients and the people that they serve. And so they developed these little learning communities. They partnered up to study together, and they learned how to problem solve and really approach this from a really innovative and collaborative perspective. So I think for me, it's individual contribution to the community, it's group dynamics, it's contribution to how our team works together and how they problem solve throughout this work. And I think for me, that's all the success we need, is just helping people become better professionals and more well-rounded professionals.
Great, thanks. Lucia, Jacqueline, anything to add from your perspective?
Yeah, I can add something really quick. I think what I have been the most impressed about is how quickly apprentices develop their leadership skills in their own community. So, because we have to think about the reason why we're here is because we come from those communities we serve. This is not about us individually, right? It's about we want to better our communities because that's where we live, that's where our children are growing up. And environment is really important. So creating an environment where individuals feel like they're able to thrive. So once you start to understand that this is a profession, that your lived experience matters and is part of the requirement of why you're here, right? It just gives you so much pride. And so although you are, providing learning opportunities and trainings, right? The lived experience you cannot take away. Like that comes with you. So you have to have that, or otherwise it's just not going to work. You're not going to have community health workers. You're going to have like other individuals. And so being able to see them thrive through that has been pretty impressive and extremely powerful. I know that there's a lot of stories for individuals that, didn't feel like they could, go to college. There's other options too, because credentialing is not for everybody. As a matter of fact, and this is something that, I'm a little sensitive about, this is my own opinion. We do credentialing because we need to make other entities feel better about our profession sometimes, right? Because there's something to be said about education, but we've been able to, get a lot of training and a lot of opportunities to individuals. But you have to have, at the end of the day, be able to be that type of a person. You have to be a community health worker at heart, and then we can enhance all these other things. So I don't know, Jack, if you want to add anything else, but that was my.
No, I think you said it all, Lucia. Thank you.
Liliana, any thoughts from the MA side? Oh, okay. We can't hear you. It looks like you're on mute on our end. Okay. Unfortunately, I can lift up anything that you want to share in the chat, or otherwise, I'm sorry that you're having tech issues there. Oh, gonna come back in. Okay. All right, I'm gonna switch to, admittedly, this is gonna be a combo question now because there's been such a rich discussion. So I wanted to pose questions to you all. Let's see here, Liliana.
Yes, I'm back. Can you hear
great.
me?
Okay, you're
Yeah,
back.
thank
Wonderful.
you. I apologize.
No.
Two things that I want to mention, and I think is partnerships, and the partnership with the Department of Labor, who were really open to work with us to develop the tray, and obviously the partnership with the community health centers, who gave us really a lot of information, but also, from their experience about all the training that they do to be able to develop this program. So that was key factor for the success of the program. And something that I wanna, talk to also what Renee was saying is being able to provide somebody with access to a higher education without having the constraints on a new financial obligation. So I'm going to give a story of somebody who is was in the call center, really wanted to go into the medical field, more working with patients, and she now is part of this program. She is planning to go into an RN school at some point and really figure out other long remember programs that will allow her to do that. So I think this is the beginning of, and she just felt very grateful to again have a model that doesn't provide barriers for her, but the opposite way, encourage her to learn something, earn, and being able to still support her family financially. And on top of that, being able to work within a cohort with the other people who are going through the same experience to feel like maybe sometimes you have doubts about yourself, or there are concerns about how fast that you're learning, but you're able to do that through your journey warning or coach, but also through your cohort. So I think that's the success has been the community piece around apprenticeship programs and all the support that is given at the site level, but also from the sponsor program that is us, to be able to do a lot of communication and one-on-one to figure out what else is needed. I think at the end of our program, we want everybody who have taken the national exam and to have an opportunity to do that, to allow to one more credential and certification for them. So I think for us, it's just the core program are our apprentices and our health centers who are the sites in that. So that's what has made it successful for us.
Thank you so much, Liliana. Time is flying, I have to tell you, and we have so many more questions from me, from our chat. So I'm going to combine a question into one, and you all answer it however you see fit. But the question I wanted to pose to you all is around the requirements that are associated with registered apprenticeships and how you've made that work. How have you navigated the requirements of apprenticeships? How have you tailored your apprenticeship programs to meet the needs of professionals that come from community, like community health workers and medical assistants? Would you just tell us a bit about an example of turning an apprenticeship as a theoretical thing into reality, and into a reality for CHWs and MAs? I'm going to start with Jacqueline or Lucia, whomever you'd like, and then I'll pass it along to Liliana and to Renee.
Sure. So we had this thought many years ago. Like I said, it was about 4 years ago. Jackie is the one that started looking into it because of this HRSA grant that we were trying to get. And that came out of the National Association. They were really pushing us for, thinking outside of the box. And we thought, there's no way we're not a college, right? So it just had a lot of complications. So when we did the partnership with Ibero, it was great because they already had a lot of things in place that as a non-for-profit Community Health Workers Association, we just didn't have the capacity for it. But really, completing the application, we have a great partnership with the Department of Labor, at least our local person that comes and does the audits. They do have specific rules that has to do with HR. For example, the apprentice has to get paid a certain or above certain amount. There has to be supervision. There is kind of like a contractor agreement that the students, the apprentice has to sign along with the journey worker. And there's a blue book, which we have not mentioned that everybody loves, which Liliana helped in creating an electronic version, so which is great benefit for us. In the blue book is basically where you keep track of your hours. And those hours also have some restrictions because it cannot be that you can count vacation time. So, there's all these components, but I think we have gotten used to managing around that. I think for us, the most critical part is the journey workers because it's 1-to-1 ratio, and that becomes a challenge for us. As we continue to graduate more and more, we'll have more journey workers. But, so that's just kind of a little bit about that. I feel like because we have such a great partnership with the Department of Labor, that it was somewhat of an easy process, but it took a long time.
I can add to that. I think I will ditto Lucia's point about the blue books, and we appreciate having the electronic version. But I do think there is even ways to improve that process. Having to tally competencies against every working hour is a bit of an administrative burden for both the CHWs and for the journey workers. Our community health workers have to document in several systems already. And so, having another task to document that we think could maybe be reconsidered or rethought might be a way to help improve the program going forward. The other thing I think, and the major adjustment we've had to make is really acknowledging the uh, commitments that our community health workers have to both the job demands and the demands of the apprenticeship learning. And so we really had to reconsider how we get the college level coursework completed. We've offered our team blocked time for study and assignment completion. But the realities are a standard level, college level course requires a lot of out of the job study and reading and assignment completion. And as an employer, we cannot ask them to do more than what they are already doing between the normal working shift. And so we had to come to contention with that and really think about how do we make this more manageable for our team members. And so we had to make a curriculum adjustment. And so we, in our third cohort, really thought about how do we simplify the curriculum and work with our learning partner to do that, make the assignments more manageable, and emphasize on real work application through more discussion, more group work, and condense the reading assignments quite a bit. I think there are arguments on both sides about what that does to the rigor of the course, but I think for us, it really relieved a lot of pressure from our community health workers and made them more engaged learners. And I think we got a more valuable product out of it.
Thank you. I agree with Renee and Lucia. The on the job hours and the tallying of the competencies is pretty hard and it's challenging just because when an MA sits with somebody, it's a lot of the competencies, the intake, how you take your blood pressure. There's a lot of things that you do and being able to break those are really challenging. As Lucia mentioned, also the Blue Book, when we heard about it, we're like, oh, I don't know if this could be the barrier for us not to even do the program because we don't know if we'll be able to do it. And what that is the one that we have to report all the competencies and all the hours that are between on the job training and also the related instruction. We did have asked for flexibility about creating electronic one, and it was granted. So we're very grateful about that with our partners with DOL. But still, it is hard for them as medical assistants, as you said, are going through electronic medical records and many other things that they have to document. For us to document one more thing becomes a little bit challenging. And I want to give, it wasn't, I didn't create it. It was my whole team who really, we thought about doing an electronic piece, the Jacqueline team who made that possible. So I think that still becomes a challenge. And the beginning of the application where we have to do wet signatures and mail things out, delays, starting with new sites as well. This is something that might be also a barrier for expansion as well.
Thanks so much. All right, I'm going to pull something together from various questions in the chat, which is around connecting apprentices, once they finish their apprenticeships with ongoing employment opportunities. I'm going to pose that particularly to you, Lucia and Jacqueline, because Montefiore CHWs are trained in Montefiore and community health center MAs are working in community health centers. But could you tell us a bit about, or offer your thoughts really, around what opportunities there are and what even greater opportunities exist to connecting CHWs with ongoing opportunities for employment? And like someone in the chat mentioned, are there any opportunities related to sharing better information around CHWs that are trained through the apprenticeship program?
Yeah, it gets a little tricky. Recruitment definitely gets a little tricky because, well, first of all, they have to be employed by the entity. So for us, we have to hire them just like we will hire anybody else. We recently just hired 3. We're about to hire our 4th community health worker that's going to be part of the apprenticeship. So from the beginning, we talk about what that means, right? What those requirements are, and are you willing to engage in that? Because it's different. There's definitely a level of follow-up that's different. Our hope is that we will sustain jobs. So it's kind of part of our own recruitment, but we are also training them to be at other locations, but they still have to be employed by us. So we have a couple of churches that we partner with where they're going to be located. We have some other community. So we have some limitations because once they complete the apprenticeship, either we hire them or they will go into another position somewhere else. But what I can tell you is that we do have some individuals who are brand new, so they don't really have a lot of experience. So what that means is that they're starting their experience not only with someone who's supervising them, but who is training them in their profession. So that's a different model versus, I'm going to hire someone and we're going to do the training. No, this is like part of your development, right? Is this learning journey where you are expected to participate and grow, right? Like and develop yourself. So, that has been extremely beneficial for us. And also the fact that our students are also eligible for scholarships. So that can also open up the doors for additional, things that they wanna do.
And I just want to add that we're very fortunate that we partner with Ibero. Because we run our community health worker training, we run 2 cohorts a year, and they're very, very successful. Our full cohort, we graduated 20 students from the community health worker training. And so Lucia is able to, she knows the students, so she's able to identify which students will make great, not only employees of Ibero, but also apprentices. So she's able to get employees from our CHW training.
Thank you so much, Jacqueline and Lucia. That's great. There are a number of different questions in the chat around funding for apprenticeships, both the training, the sponsor side and the employer side. So I wanted to ask your general thoughts on how you all have and what you see the needs are for funding apprenticeship programs. Before you answer, I do just want to take a moment to call out an important difference that I've observed in terms of apprenticeships in public health and healthcare relative to other industries. Other industries, like manufacturing, where my family works, when you have an apprentice, you get a tax break. For if you have a welder, that's an apprentice. But for nonprofit public health and healthcare institutions, there aren't those same opportunities for tax breaks. So I know that we're talking about a different financing environment when we're talking about funding and supporting apprentices on both the training sponsor side and on the employer side. But I'd love to open it up to you all to talk about how you see funding sustaining this work and where you see more or different types of funding needed. Let's see. Liliana, do you want to get us started?
Yes.
And then I'll hand it to Renee and then Jacqueline and Lucia.
So we have been fortunate to receive private funding to do this program. Something that was very key for us is to be able to do different things. Training somebody costs and costs decide, and as we see, so being able to support the health centers to provide some funding for the site is pretty key for this to be successful, because it has a cost attached to it. Also, we are adding additional responsibilities to journey workers. So how are we supporting that as well? So thinking about that is something that it is part of our program. We do offer a stipend for the journey workers to support that, and really to maintain curriculum, and the program itself needs funding. So I think this is an ongoing need, as we're thinking about changes even to medical assistants at some point at the state level. We want to be ready to adapt our curriculum to those changes, because healthcare is something that evolves, and as things evolve, we need to make sure we are ready and prepared to change the way in which we train people, competencies, everything that they need. So ongoing funding is pretty key for the sponsor organization, for the training, for the employers, and also for the apprentices. So I think that's crucial in order to be successful. Without that, it will just be I don't know if they will be able to something sustainable for anybody. Thank you.
Yeah, I'd love to just add, one thing to what Liliana said, so beautifully said, I would say. I think the healthcare industry and for me, the community health worker space we're at a really critical time frame, right? We've been talking about the challenges of sustaining community health workers for a long time, and with the introduction of these pathways to reimburse for CHW services, it really puts our institutions in a difficult space of trying to navigate, how do we focus on optimization, on efficiency, on productivity to ensure that we can, generate the revenue necessary to sustain staff, but also balance that with robust and rigorous training programs. And if we don't make improvements to how we administratively plan for training, I think we'll be in the same space discussing how we're going to sustain our staff for the foreseeable future. I think we have to think about how do we make our training process rigorous, but still efficient, and still lend to the things we need to get done on the job to help retain the team.
I think for us, we worked very hard to secure some funding, and we have partnerships. We did receive a grant from Schumer for through the Department of Labor, it's federal grant, and that pays for 500 hours of our community health workers. And that's a 3-year grant, so that is going to sustain us for a little bit until we get going. There are some billable services happening with community health workers, but it's primarily because of the waiver. We want to train more community health workers or navigators. That's a whole nother thing because we're not utilizing the title. But there's opportunities, and that's one way in which we can bill for those services, but it comes with challenges. I mean, most programs have been funded through grants, and we're trying to stay away from that, but there's benefits to that as well, especially when it comes to public health efforts.
Great. Thank you all so much. The hour has flown by and we haven't gotten to all the questions. Thank you all so much. There were important things around partnering with sponsor organizations, recruitment, and otherwise. And importantly, in the chat, I want to thank you all for chiming in and saying, we have a SUNY program, or we have an MSW program, or we have job openings. It really was a collaborative effort there, and it was great. And like Frank said in the chat, this merits a whole nother conversation. Medicaid reimbursement merits a whole nother conversation. So many things that you all brought up, and we would love to stay connected. So first and foremost, I would encourage you all to stay connected with the New York Health Foundation. I would especially encourage you all to stay connected with Schwar, with Ibero, with Chicanes, and with the CHW Institute at Montefiore Einstein. Thank you all today. This is just the beginning of the conversation. It's not the end of it, but I got a whole lot out of this, and I hope that you all did. And so major, major thanks to Jacqueline, Lucia, Liliana, and Renee for your time. And thank you all for being with us.
Thank you.